Sobat Tekon TV. Gagal ginjal merupakan salah satu penyakit yang berbahaya, terlebih lagi jika statusnya sudah menjadi kronis. Sebelum semakin parah, apakah ada tanda-tanda seseorang mengalami gagal ginjal yang bisa kita pantau? Berikut penjelasan dari Dr. Loh PIng Tyug.
Now, what are the signs and symptoms that you potentially may experience? Fluid retention, as in swelling in the legs, ankle, or feet. Why in the legs, ankle, and feet? Because by gravity, the water will go down to the most dependent area, which is your legs and ankle. So I sometimes patient will tell you only after walking for a long time, the legs swell up, but when they're first thing in the morning, is okay, because when you lie down, the water is distributed throughout your body onto your back and into your lung. You don't see it, but the days goes by, your leg get more and more swollen. You might feel short of breath for two reasons. Actually, for three reasons. You can have shortness of breath because the water build up in the lung. You get shortness of breath because you're more anemic, or eventually the shortness of breath will get quite severe when the acid starts to build up in the blood as well. So you're actively trying to blow off the carbon dioxide to reduce the acid level in your blood. Some may even experience chest pain or chest pressure due to the high water buildup and strain on the heart. A person may feel fatigued, easily tired, wants to sleep all the time, because a person's anemia, as well as the waste level buildup causes the fatigue. When severe enough, they can have confusion because the waste product is very high. Some may even cross the blood-brain barrier and causes confusion. Nausea can come by the time you reach stage 4. Some patients can even tell you when they're brushing their teeth, they can feel like they want to vomit, or the taste of food or the smell of food makes them nausea. So this is at the very severe stage of kidney failure. This type of symptoms will appear. Weakness, because the body is high in potassium level and low in calcium level, they can present with weakness. And that can also be the reason for the irregular heartbeat. Due to the low calcium and the high potassium level. And some patients may even have uremic breath. That means that they have the smell of ammonia in their breath, like smell like urine when the breath.
Apakah penyakit gagal ginjal akut ini hanya menyerang orang-orang di usia tertentu? Bagaimana dengan gaya hidup? Apakah sangat berperan dalam menyebabkan seseorang menderita gagal ginjal akut?
So, who are the people at risk of chronic kidney disease? Elderly, anyone reached the age of more than 60 years old. Why is that so? Well, not everyone aged 60 years old will have chronic kidney disease, but they are at risk is because, as I said, how many kidney filter you have that's what you have for the rest of your life. As you age, you will lose more and more kidney filter, and that's why if everybody live long enough, you will have some form of reduced kidney function. The patient with diabetes, because diabetes destroy the blood vessel, therefore reduce the blood flow to the kidney. High blood pressure, again, because it destroy the kidney the blood vessel, and leading to basically narrowing and thickening of the blood supply to the kidney filter. The heart, cardiovascular disease, so any heart problem that you may have potentially if you have reduced heart function, so your heart is not pumping enough blood to the rest of your body, including your kidney. So your kidney will actually suffer due to not enough blood flowing through it. So if you don't have enough blood flowing through your kidney cannot clear the waste. Malignancy. Why cancer is actually a risk factor as well, because any cancer that involves the abdominal part can potentially causes obstruction to the kidney tubing, the ureter, and as well the cancer treatment, the cancer drugs were actually, some of the cancer drugs are nephrotoxic. They can actually destroy the kidney cell and the filter. Gout, okay, when you have gout, actually when you feel pain in the joints because of the deposition of the uric acid in your joints, same deposition of uric acids happen in the kidney as well, in the kidney tubings and in the piping part of the urine pipe. But we don't experience pain in our kidneys because the kidney itself have no pain receptors. So don't think that the gout only affects the joints, actually affects the kidney as well. Every time you have a gout attack, it's harmful to your kidney. Kidney stone, so if you have stones causing obstruction, urine cannot flow out properly, it will cause back pressure onto your kidney and slowly destroy the filter. Any autoimmune condition, for example, lupus, IgA, these are the conditions where your own body produce antibody that attack the cell. And unfortunately, kidneys are usually, because kidney have blood flowing through it and the filter traps all this antibody, so the antibody can actually damage the kidney filter as well. Thyroid diseases, either hyperthyroid, as in high in thyroid levels, or low thyroid levels, both can actually cause kidney disease, because our body needs normal thyroid hormone to function properly, including the kidneys. So people that are born with low birth weight, as in they're small in size at birth, it's because the reason is when you're smaller in size, you have less kidney filter at birth. Preeclampsia, meaning a condition where you have very, very high blood pressure during pregnancy, usually come on at the third trimester of the pregnancy. The blood pressure can get really, really high and can destroy the kidney in a very fast manner. The viral infection, especially the hepatitis B, C, and HIV, they can also directly harm the kidneys. Patient with recurrent UTI, if they don't actually pick up properly and treat it well, especially if the recurrent UTI, in fact, as in the kidney itself, is the one getting infection, not just in the bladder, infection extend to the kidney itself, that can, after a long recurrent disease, it will destroy the kidney filter. Anyone with a family history of kidney failure, potentially if the reason for the kidney failure is genetical, as in, for example, in polycystic kidney, that can be, you should be aware and go for checkup. Anyone that recovered from acute kidney injury, AKI, means that you've taken the wrong medication or wrong or something that causes your blood pressure to drop. For example, in the situation of sepsis, your kidney acutely shut down. But when they recover, usually they don't recover to the full kidney function. So they are more at risk of getting chronic kidney disease.
Jika sudah melihat adanya gejala atau tanda-tanda dari gagal ginjal kronis, jenis pemeriksaan apa yang seharusnya dilakukan oleh pasien untuk memastikannya? Berikut penjelasan Dr. Loh PIng Tyug.
Now, it's very easy to pick up who have or who doesn't have chronic kidney disease. Very simple test, very not expensive as well. You do a urine test, you look at any urine red blood cell, white blood cell, any urine cast. And urine can also pick up any UTI. And we look at for urine protein and urine albumin, because the level tells you how much protein have passed through your kidney filter, which not supposed to. That means your filter has lots of damage. And the blood level of your waste, for example, the urea and creatinine, because they're the cheapest and easiest one to do. And usually we will estimate the GFR. I'll come back to that, and kidney ultrasound. So why do we look at GFR? Okay, if you just measure creatinine, sometimes a creatinine can be normal. For example, the blood creatinine, the creatinine level is only 1.1 or 1.2. In a small size person that is only 40 kilo, a creatinine of 1.2 or 1.1 is actually a quite severe or moderate damage of the kidney function already, because the creatinine will not factor in your weight, in your height and your age. As you age, you lose muscle mass, you lose weight, so your GFR will drop, whereas the creatinine will still stay quite normal until your GFR drop down to less than 60. You start to see someone's creatinine goes up. So actually, it's important to look at the GFR, not just the serum creatinine, if you want to pick up chronic kidney disease in an earlier stage where you can make a difference.
Kita tahu bahwa kondisi tubuh yang sedang sakit harus diperhatikan dengan baik agar bisa kembali pulih dan penyakit tidak semakin parah. Lalu, bagaimana cara mengontrol kondisi tubuh pada penderita gagal ginjal akut? Sebelum mendengarkan penjelasan Dr. Loh PIng Tyug, yuk tekan tombol subscribe dulu biar kita tambah semangat buat bikin konten yang mengedukasi kamu.
Now, if you have chronic kidney disease, what can you do? Okay, it's important to control the blood pressure, because if your blood pressure is high, it will continue to damage more blood vessel, it will continue to damage the kidney filter, and causes you to lose more and more filter. And it is also important to know not to have too low a blood pressure, because your kidney needs a certain amount of blood flowing into the kidney. So it's important to know what blood pressure and when is your blood pressure high, and the 24 hours a day, what time of the day your blood pressure is. So it's important to actually check your blood pressure. In fact, if you can, on a daily basis. If your kidney function is quite moderately damaged, you should actually make it a habit to check the blood pressure daily. If you have diabetes, you should know what are the blood sugar goal that you should achieve. If you're young, it will be advised to actually aim towards a lower sugar control level compared to someone that in 70 or 80, because the diabetes damage the kidney in the long term. Okay, if you have like 20 or 30, 40 years to go, you need to control it as well as you can, so that this kidney can last longer. If your lifespan is
80, it is not advisable sometimes to control the sugar too low, because you may run into a problem of too low a sugar level. So it's important to know what is your blood sugar goal, and discuss that with your doctor based on your kidney function. Regular check to monitor kidney health. Why do we need regular check? Is unfortunately chronic kidney disease most of the time is asymptomatic, as in you don't have any symptoms at all until you reach quite to the stage 3B or stage 4. At that time, some people might not even have symptoms. They just look as normal and then they function normally. So they may not know they have a kidney problem unless they do a blood test and urine test. And always understand your medicine and how it works in your body. So your doctor will give you medicine for your high blood pressure. They give you medicine for diabetes. They give you medicine for cholesterol. It's important to know what this medication do and how it affects your body, because 1/3 of your medication are cleared by the kidneys. As your kidney lose this function, the medication will build up, so the effect of it will be much stronger when your kidneys start to lose function. For example, let's say you are on a beta blocker, which slow down your heart rate. If your kidney start to lose its function, the beta blocker effect will be much stronger. You find that the heart rates were very low, and you will know why. So it's important to understand your medicine. For another example is diabetic medication. Your diabetes medicine, a lot of them are cleared by the kidney as well. As your kidney start to lose function, the effect of the diabetes medicine get much stronger. You find that your sugar level, how come suddenly got quite so low, so well controlled? It's not because you are eating differently. Most of the time, it's probably because the medications start to have a stronger effect in your body because it's not being cleared by the kidney. It's very important that you develop a meal plan. And this is very, very important, which I will come back to it and elaborate further. Always stay physically active. Why? Because when you're active, it improves the blood circulation and you help your body get the blood through your whole body and get all the waste out and then clear by your kidney. So it's important to stay physically active if you can, walk around, move around, so that as long as your heart is able to do that, obviously. Okay, aim for healthy weight, because if the more body mass that you have, the more waste your kidney needs to clear. So, and maintain a good healthy weight so that it doesn't cause more burden to your kidney. It's important to get enough sleep, because if you don't get enough sleep, your blood pressure will go up, your stress level will go up, the stress hormone will go up. All these are harmful to the kidney. Stop smoking if you are a smoker. Find healthy ways to cope with stress. Again, this is because when you're stressed, your blood pressure will go up. And again, I put blood pressure right on the top here because blood pressure is the most important thing to determine how long your kidney lasts. Because your kidney needs the right amount of pressure, not too high, not too low. Now, this is the part that okay, the last slide is on what you need to do. So the 10 things that you need to do, okay? But this is an extra thing on what you need your doctor to do, okay? But sometimes your doctor do not know you have kidney problem, other doctors that you don't normally go to, or you only encounter the doctor because you start to have certain problem. It's important to know what they're gonna do so that you know you need to know they need to watch out for your kidney. Okay, medication error. There are certain antibiotics that are harmful to the kidney. Most doctors should know, but just in case you're on antibiotic and you have chronic kidney disease and your kidney damage is quite severe, you need to tell the doctor that and you make sure this antibiotic is not toxic to my kidney. But in a certain case where there are no any other antibiotic, let's say this bacteria is a very resistant bacteria, only this particular antibiotic can kill it, but this particular antibiotic is harmful to the kidney. Sometimes there is a risk and a balance that you have to achieve. You have to maybe actually adjust the dose so that it matches the kidney function. Also, the other very, very harmful medication is a painkiller. Usually we call the NSAID, the non-steroidal anti-inflammatory, and the COX-2 inhibitor. They are harmful to the kidney because they reduce blood flow to the kidney. So you can be treating the pain, for example, in gout or after orthopedic surgery. You may have to take this medication to reduce the inflammation. But while you're reducing the inflammation, if you take this medication long enough, or if your kidney is already quite damaged, it can further harm and reduce the kidney function. Improper dosing, for example, if let's say the doctor do not know your GFR, your creatinine level may appear normal because you are quite a small person or your muscle mass is low, you have a very small weight, your creatinine may be normal, and so the doctor might give you a dose of the medication that is over your actually what your kidney can clear. So it causes more the effect, you experience a more side effect of the medication because your kidney cannot clear the medication well. Inadequate monitoring. There are medicine and supplements that have sometimes high in potassium, some are high in phosphate, some actually can cause low sugar. Like for example, diabetes, you have lower sugar level because your kidney function is low. So these are the one that you need to watch out for, and that's why a frequent monitoring will pick up blood test to pick up whether you have all this effect due to a medication that was introduced to you, but your kidney function is low, and the effect of it may not be picked up if you don't monitor it. Diagnostic tests, for example, a contrast study to look at your heart vessel, whether there's any blockage, or contrast to look at your leg vessel, whether there's any leg vessel, any blockage in your leg. This contrast is again harmful to the kidney. If you have kidney function, your kidney function is not good, they don't clear the contrast very well, the contrast can build up and cause more kidney damage. So it's important to know and what your kidney function is when you do a contrast study, because a contrast study, what you need to then decide, is this life-threatening, then there's no choice. If this risk has to be, as in the benefit of it have to outweigh the risk of potential kidney injury. Gadolinium usually used in MRI as a contrast for certain part of the body that are better well imaged by MRI. If you have reduced kidney function, because gadolinium is cleared by the kidney, if you have reduced kidney function, you're not able to clear the gadolinium. Sometimes if you do a lot of this gadolinium MRI, this gadolinium will build up in the soft tissue, and what it will cause is what is a term called systemic fibrosis. Is your skin will get hardened to try to basically around the place where there's gadolinium deposit around the skin, the soft tissue, the brain. So these are we will see this in patients with very, very low kidney function. They shouldn't go for a contrast MRI. Patients that are going for scope, they should avoid high sodium phosphate bowel prep, because the sodium phosphate can actually accumulate and causing obstruction in the kidney pipe, and that leads to acute kidney injury. So these are potential things that you may need to go to, and the doctor should know your kidney function, and you should, if not sure, ask the doctor to speak to your nephrologist so that to kind of weigh the risk and the benefit of the procedure. Fluid management when you're in hospital is important when you're fasting for a procedure to prevent dehydration. Sometimes you may need to be put up on the drip while waiting for the procedure, and hypotension because you're not able to drink or eat because during the fasting for the procedure. It's important that all these are potential things that can actually harm the kidney further. A heart failure exacerbation is there are certain, let's say you also have a weak heart on top of a weak kidney. So if you actually give someone too much fluid, too much water during the procedure, if it's a long operation, sometimes the fluid can build up and causes heart failure because the kidney can't clear the fluid, the excess water. So these are the things that you would like your doctor to know, but you should know so that you can actually highlight to your doctor when you're unfortunately, if you're admitted or you have some procedure that you have to.
Bagaimana diet sehat yang disarankan untuk pasien gagal ginjal akut? Apakah ada jenis makanan yang harus dikurangi atau bahkan dihindari?
Go to. Now, come back to what I mentioned about meal plan. Okay, it's important to know what you can eat and what you shouldn't eat. So let me go through the think about meat. Why we talk about meat? People with kidney disease can eat meat. Okay, not that they can't, but if they can, they should reduce meat or become a vegetarian. But if they can't, they can eat meat. But it's important you know and prepare the meat based on the dietary restriction, which we will talk about later, and the portion. Okay, because kidney is responsible for killing out the excess protein waste. So if your kidney cannot filter the protein, this protein waste will build up and cause the kidney to have to work even harder. So the kidney will get even more damaged if it has to work harder. So when it comes to a patient with chronic kidney disease, your doctor, your nephrologist will always talk to you about if you can reduce meat intake. And as your kidney worsen, as your kidney function drop further, maybe you should consider become a vegetarian, go on a plant-based diet. But if you want to continue to eat meat, it's generally a very easy guideline is to choose 1 serving per day. That means if you're gonna have a meat in at lunchtime, you should not again have the meat in at dinner, because 1 serving is about 1 ounce, which is less than 30 grams of meat. Basically, it's about the size of your palm. Okay, well, you should have an average size palm. Not if you have a, hopefully not a big hand. Okay, so about a size of your palm should be the rough guide to how much meat you should have, and that should be the 1 serving per day. But obviously, if your kidney function continue to drop and you're having less lower function, you should be actually limiting the meat at all if you can. Egg white is a good alternative source of protein, but the same proportioning applies. Now, I often mention to all my kidney patients to reduce salt. Why? Because kidney can't get rid of the salt when the kidney is damaged. The salt will build up, the water will retain, the blood pressure will build up. So when you have a higher blood pressure, you need more medication to bring down the blood pressure. That adds some more burden to the kidney. So if you can reduce the salt or no salt, so easier way to do is eat vegetables, because vegetables usually don't come in salt. Choose the plain fresh one, not the canned one or the pickled one. If you need to choose the meat, fresh is best. Okay, the meat usually go for the skinless chicken, fish, and the lean cuts of meat. Okay, rather than don't go for the marinated one, the already in the can, or the smoked, the one that added salt, brine, or cured, because they have lots of salt in it. So a dry salted fish is a no-no. So if you eat just a small little piece of dry fish, salted fish, the amount you have, actually you can have the salt for the entire week. Always check the nutrition facts label on the food that you buy, so that you can compare the sodium levels in the food. Okay, always go for the low reduced sodium or no salt added. That will be better. Okay, pay attention to the preparation of food. Example, the pickled one, those with condiments usually have a lot of salt in it. For example, the condiments such as mustard, ketchup, barbecue sauce, those have lots and lots of salt in it. Cook your rice, your noodle or pasta, or even your hot cereal without salt. Okay, don't add salt into the when you boil the noodle or the pasta. You should reduce. You should not go for the instant rice, noodle, pasta, or cereal mix, because they already usually will have salt added onto it. Prepare and eat more food at home, because when you eat at home, you can control how much salt is added, and you can because when you eat out, there's no way you can actually reduce salt. Okay, without salt, some patient will tell me there's no taste to their food. Actually, there's so many ways you can add flavor to your food. Any herbs you like, any spice, you can add lime, lemon, vinegar, etc. to make your food have different flavor. It doesn't have to be salt. Watch the potassium. So things that are high in potassium here, as you know, kidney is supposed to clear the potassium. So if you don't actually watch out for the food that are high in potassium, the potassium can cause your heart to beat irregularly and causes heart problem. And some patient might even actually collapse and feel very bad when the potassium level is very high. So go for the grapes, cherries, bell peppers, cauliflower, cabbage, olive oil, onion, garlic. These are all the good low potassium that you can content or that you can add to your food. Avoid avocado, bananas, honeydew, dry fruit. Usually all the dry fruits have quite high potassium in it. The legumes, your milk, nuts and seeds. Okay, the orange juice, all the pumpkin, buttersquash, and potato. Okay, potato is important to know that potatoes are high. Potato and tomato are high in potassium. Now, be very careful when you choose the low sodium food, because sometimes when you taste the food, it labeled as low sodium, but it still tastes salty. The low sodium is substitute with potassium salt to make the saltiness. So be careful when you go for low sodium food, although you want the low sodium, but they may actually substitute with potassium salt. Okay, the other minerals that you need to watch out for is phosphate. Usually comes in the dairy, so milk, cheese. Okay, again, the nuts and the seeds and the peanuts, all the nuts, all no. Okay, the beans, the peas, then you have the grains, your cereal, your oat. Okay, you can eat them. You just need to know how much quantity so that your phosphate level does not become too high. Things that are in the chocolate, your Milo, quite high in phosphate. So these are the top 10 highest phosphorus food. First one here, tuna, pork chop, okay, tofu, milk, chicken, scallop, the lentils, the pumpkin seeds, the beef, the quinoa. So actually, if you cut off your meat, most of the phosphorus is actually not so difficult to control. Okay. Now, this is a guide how you look at the food label. Don't look at the percentage. Always look at the milligram. So here it says sodium 180 milligrams. So how much sodium you should have per day should be less than 600 per meal. Or if you want to count the day, it should be less than 2 grams per day. But per meal, it should be about range between 500 milligrams per meal. So look at your salt content. Pay attention to the potassium. So go for the low potassium. Low potassium should be less than 100 milligram. Anything higher than 300 milligram is very, very high potassium. So always choose below 200 or below 100 if your potassium level is high from the blood test. Phosphorus, again, go for 50 to 100 range. Anything more than 100 is usually quite high in phosphate. Pay attention to the phosphoric acid. It's actually a very, very high source. It's a preservative, so it's also a very, very high source of phosphate in the diet. Now, with such a restricted diet, you will need supplements, because, for example, if you cut off meat in your meal, you will be low in protein. So your body can't make protein. So most patients will be supplement with keto acid. You need your iron, because if you're not eating meat, you will be no source of iron intake. You need your calcium because you cut off milk. So your calcium and kidney, when you have kidney damage, again, the bone, you will develop this thing called the kidney bone disease, where your calcium level is low in your blood. So the calcium then come out from your bone to make the blood calcium level normal. So it becomes a problem. So these are actually the essential supplements. Okay, the rest of the supplement that you're taking, they are usually not if you have chronic kidney damage. Okay, these are the 4 essential supplements that most of your nephrologists will give you. The rest of the supplements are not the essential that need to have. Okay.
Jika ada makanan yang harus dihindari, pastinya ada juga dong makanan yang disarankan dan baik untuk pasien gagal ginjal akut. Kira-kira makanan itu apa saja ya? Yuk simak penjelasan Dr. Loh selengkapnya berikut ini.
But then we say, okay, I can't eat this, I can't eat that. What can I eat? Okay. These are the 5 food that you should have in your diet if you have chronic kidney disease. Okay, apples. Okay, they are good because they're high in anti-inflammatory compounds. They can prevent constipation because now that your kidney can't clear the waste, it's important you clear the waste the other way by make sure you have a healthy bowel habit. So apples, if you can have an apples a day or 2 apples a day to substitute your lack of other things, that would be good. Grapes are antioxidant. They increase blood flow, which is good for your kidney. They have plenty of vitamins and minerals to leave you feeling healthy. So grapes are good. Cabbage, again, a very, very good vegetable. Okay, lots of phytochemicals. What are phytochemicals? They are basically chemicals that break up free radicals. It's not good to have free radicals in your body because they cause cancer, they cause the cell not able to build properly. So these are able to, so cabbage have lots of that. Cabbage is also high in vitamin K, vitamin B6, the B9, and the C. So it's a actually very good vegetable that you should have if you have kidney problem. Red pepper, again, not only have a good flavor to your food, it's low in potassium, but again, high in A, folic acid, vitamin C. Okay, olive oil, because it's anti-inflammatory. Okay. It protects against inflammation and oxidation. So these are the things that you can add to your daily diet.
Masih telah menonton video ini, jangan lupa subscribe channel Tkon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.